Hi, everybody. Good evening, and welcome to Health Plot Conversations today. My name is Dr. Vanessa, and I'm your host for today's session. It's been so long, I know, since January, but we're here once again to get you plugged into the right health with the right health experts. And I'm excited today that you are joining us wherever you are joining us from. We are live from all across the world. So, good morning, good evening, good afternoon from wherever you're joining us from. And I'm excited to have you here. I just want you to be able to share the link with someone, invite someone, because today is honestly going to be very refreshing. You're going to leave here with more health knowledge than you came. So, bring your questions, bring your friends, bring your family members, bring everybody because it's about to really go down. So share the link to your WhatsApp group, to Facebook, to LinkedIn. Let everybody know that it's time, it's Health Plug time. Awesome. Today we're going to do something amazing. We're going to talk about an important topic in health, one that we see a lot of thing in our consulting rooms, especially among the young people. In a couple of days, we'll be celebrating hepatitis. So this time we'll be talking about hepatitis B, understanding what really it is, being sure that we have enough knowledge to know how it looks like, what we can do about it, and I've got the best amongst the rest. I've got the creme de la creme from all across just for this conversation. So you just want to be locked down, ready to hear from them and add value to yourself today. So, in no particular order, I have the pleasantry of introducing our amazing guest. Okay. So, our very first guest is coming all the way from Nigeria. We know that Nigerian and Ghanaians are brothers and sisters, so we're excited about it. She's a medical doctor by profession, also a top LinkedIn creator. She's currently working at University College in Ibadan, and she's very passionate about health, especially helping doctors really excel in their personal brand when it comes to medicine, and also really speak about health and make sure that people have the right knowledge about it. So, without much ado, allow me to welcome to our stage Dr. Valerie Okore. Hi, Valerie. You're welcome. Good to see you.
Thank you. Thank you very much.
I hope you're doing well.
Yes, I'm doing very well. Thank you. Thank you very much.
Awesome. And as you can see, very fine, very fair, very beautiful. All our healthcare professionals are very beautiful people. So please be expectant. Awesome. So that is Valerie for us, also my medical doctor for today's panel. We'll also be having a second healthcare professional. For those of us who are on the Health Plug page, he's no new face to us. He is a medical laboratory scientist by profession, the only man amongst the women tonight. The question is, can he hold us down? Will he be able to take care of three women at the same time? Only time will be able to tell. He is a social impact advocate at the same time. And he's very passionate about health information, health advocacy, and getting you the right information all the while. And I'm excited to have him here. He is by name Emil Arthur Hayford, MLST. Please let's welcome Emil to the stage. Emil, hi, you're welcome.
Hello, thank you very much. Thank you very much, Vanessa. And
Good to
yes,
see you.
I'm very sure I'll be able to handle all three ladies.
Okay,
Wow.
okay. That's some excitement there. Guys, we are expecting to see how Emil hands us down. So that will be good to watch. So thumbs up to you. A very
Thank
third
you.
speaker is yet to join us. She is a nurse officer by profession working at UGMC. And when she joins us, I have the pleasure of introducing her to us all. Right. So let's get to the groove. Let's get ready to really understand what is about to happen. Before then, let's see what's happening in the comment section. Oh, I see Bernes is here. Hi, Dr. Bernes. Yes, you absolutely cannot wait for today's session. Me too. I absolutely cannot wait for today's session. I see Dr. Samuela also here. Awesome. Good to see you, Samuela. Great to also be here. I'm so glad that you're excited to be here. I believe all my guest speakers are also excited to be here. Right?
Yes.
So, without much ado, let's get into it. Guys, we keep hearing the word hepatitis, hepatitis, hepatitis. What's the first thing that really comes to our mind when we hear the word hepatitis? Um, Valerie, do you want to take us through? What do you think about when you hear hepatitis?
Okay, so just the way it sounds, whenever we hear like I say hepatocytes, right? That's where the word hepatitis came from. Hepatocytes are the cells that make up the liver, right? We know it's all liver, organ, tissue, cell, organ, tissue, and system, right? I mean, cell tissue organ and system, right? So when it comes to hepatitis, it's just inflammation of the hepatocyte, that is the liver cells. So there are different types: hepatitis A, B, C, and the likes. So when it comes to hepatitis, the first thing that comes to your mind or should come to your mind is the liver. So an inflammation that happens in the liver and is usually due to a virus. So that's basically, if I'm to say it in simple terms, that's what it is that will comes to my mind.
Awesome. So hepatitis, what comes to mind is the liver. Emmy, what about you? What are the very first things that come to your mind when you hear hepatitis or hepatitis B? The first place.
Right. So I think from experience, because of how I have interacted with people, I when people say hepatitis B, what comes in mind currently is that silent thing nobody seems to be concerned about until it's at the point where their organ is crying for help, or probably they see some sort of very very yellow urination or eyes getting really yellow. So that's what comes in mind. That's silent guy that nobody cares about until it is causing some harm.
Awesome. And Emil, in your practice, what really, if I'm to just tell you that, okay, let's break down hepatitis, let's break down what causes it. Can you help us with a bit of what really hepatitis B is and what causes it in our current settings?
Right. So hepatitis B, just like Dr. Valerie rightly mentioned, is an issue that has to do with the liver. All right. So you have inflammation of the the liver organ, so the hepatocytes. Now, there's a viral infection actually. So when I say viral infection, I'm saying that it is caused by a virus. So there are different organs. We have the bacteria, we have viruses, and we have fungi and all of that. But this particular infection we are talking about is caused by a virus known as the hepatitis B virus. And just like we discussed, when this virus is actually transmitted, it is transmitted when people come into contact with infected blood or body fluids. And this
Okay.
could be through sharing sharp objects, having unprotected sex, and even a mother giving birth could transmit it to the child at birth. So that's basically how it happens. And the organ that's affected, that we've been mentioning all along, is the liver. So yeah, when the viruses get into the bloodstream, they are looking at how to get to the liver, because that is where they are going to be, and that's where they are going to cause the harm. Now, if this is found earlier, and then in the we usually there are stages. So we have the acute stage and the chronic stage. Acute stage is usually in the early days of the infection, which when not checked, could graduate to the chronic state of the infection. That can also lead to other things like what we call liver cirrhosis, liver cancer, and all of those things. So I'm very sure as we have this discussion, the nitty gritties would come out. But an overview of what hepatitis B is what I have just said.
Awesome. Thank you so much. That we learned that hepatitis B is essentially a viral infection. And like the name mentioned, it affects the liver, causing damage to the liver. So, Dr. Valerie, can you tell us, in your practice as a medical doctor, how usually do people with hepatitis B present to the hospital? How will I know that maybe I have hepatitis B or I should really get it checked? Can you share with us some of the signs and symptoms to be looking out for?
Okay, so as Emil rightly said, it's silent, right? Most people do not know they have hepatitis. A lot of people do not know. And even when checked and they are tested as positive, they will still feel quite all right. Right. So most times when you start seeing symptoms of hepatitis, it's usually seen that you are now in the chronic stage. Probably the person already has liver cirrhosis, liver damage, liver cancer. That is when they will start having symptoms, and you start seeing things like, the most common is jaundice, right? They will start having yellowness of the eyes. So currently, I'm in obstetrics and gynecology, and usually have lots of women who have hepatitis, but they never knew they had hepatitis. The only reason why they found out was because it's routine to check pregnant women for hepatitis. So we would do a test on them and we'll find out that, oh, this woman is hepatitis B positive. And she's like, how? That's it's not possible. She feels fine. So many of them will feel very fine. But the most common thing you will see is a tinge of jaundice in the eye. Some might have lower abdominal pain. And when it start becoming severe, they would also have what they call abdominal swelling, ascites, even peripheral edema. That means they'll have swelling of their feet. They will have club fingers. That means their fingers will look like it's a drumstick. And also some might also have they can start having, or like say, depending whether it's liver cancer or liver cirrhosis, they can have constipation. They will have pale stool. These are just a few things that they can have, but in the early stages there's literally little to no symptoms, probably just them having jaundice. That's yellowness of the sclera of the eyes.
Wow, that's very scary to hear that it's all silent till you start having constipation. I think people take constipation or using the bowel like freely for granted, because I can't imagine being constipated and being told that it was because I have hepatitis B. That's really scary. I'm sure my audience are really worried about it. But before we
Okay.
even jump in, I'm excited to know that our third speaker is in, and I'm excited to also invite her. She's a nursing officer with UGMC, also very passionate about global health accessibility and an advocate for health education. Allow me to welcome to the stage Anna Ejewa Mensa. Anna, you're welcome. You're welcome to our session today. Anna, can we hear from you? Okay, so I'm sure in due time she'll speak with us. I believe when Dr. Valerie was speaking, or maybe Dr. Emil was speaking, he mentioned some of the routes at which we can get them. And Dr. Valerie added that a lot of times we don't know, except we are doing maybe a routine check. Someone wants to say that I want to run a check on myself. Am I fine? For the pregnant women, because it's compulsory to really know your status when you start pregnancy, we get you to do the hepatitis B test. So, what really are the means or routes at which people get exposed, people get transmitted? How can I get hepatitis B? Because I cannot sit in the comfort of my home and all of a sudden I have hepatitis B. Something should have happened, I'm sure. So, can you share with us what the various means of spread for hepatitis B are? The obvious ones. Let's start with the obvious ones at first. The obvious ones. So, yeah, any of you to take it for us, that would be great.
Okay, I think Emil has already shared most of it, right? So it's the same thing. Either you get it through body fluids or through you know, like say body fluids like blood, urine, sweat even, and possibly even what's called saliva, right? Any body fluids whatsoever, you get it through that, and you get it through mother to child transfer. That is actually why it's very routine in pregnant women, because it can be vertical. So a mother can transfer it to her child. Then, as you said, sharing of sharps. I was really scared. I won't say it's a story when I was in secondary school. Back then, they told us that there's a new disease that is worse than HIV. I was like, what can be worse than HIV? They were like hepatitis. That if you're in the bus and somebody is sitting down beside you and they're sweating and you touch them, you catch hepatitis. And I was like, Jesus. So after then, I did not want to enter the bus. Enter the bus, I wear a long sleeve. I was like, you want to shake somebody? I'll be like, no, I'm not shaking you. You probably have hepatitis, you know. because the same way retroviral disease is very silent, hepatitis is also silent. But the good thing about hepatitis is that we can detect it on time, the same way you could detect other immune deficiency viruses. But the most important thing, and I would say, is basically early testing, right? You probably do not have a vaccine for immunodeficiency virus, right? But we do have a vaccine for hepatitis. And I encourage anybody, like for health workers, the easiest way we get it is through shops. So we want to give somebody an IV fluid, we want to give someone an injection, and mistakenly it pricks you. A needle prick is the most common way we get it as health professionals. So I would urge every health professional to be very careful. How we get it is probably when you finish giving an injection, we try to cap our needles, and we highly discourage capping needles in the health practice. Once you are done, do not cap the needle. Do not try to cap the needle. We always want to say, oh, we want to cap it so that it will not prick someone else. Just throw it into the sharp box as is. An attempt to cut needle can lead to an attempt at your life. So we encourage not capping needles and trying to always try general safety practice, like wearing your gloves, protecting yourself first. And yeah, you're probably safe once you're vaccinated, at least as a health professional.
Awesome. Thank you so much for that. That's really important because sometimes I really get scared when I see new intern try to cap the needed. I'm like, your life is at stake, girl. Just put it in the sharp box. That's okay. Like you don't have to try and then be a superhero and say I'm putting it back the way I saw it. This is the only chance where you can be safe about it. So thank you so much for really bringing that out. And just to ask about the myths surrounding hepatitis. Anna, if you are here, can you tell us about some of these myths? I think I've heard that if you share the same toilet with someone who has hepatitis, you also get hepatitis. Anna, is this true? Is it true that I can get hepatitis from sharing the same public toilet? Okay, Anna is off. So, Emil, can you help us? Emil, can you help us with this myth? Is it true that sharing public toilet or maybe eating together, maybe me and my beloved has gone somewhere, I want to show love, then he takes his spoon and feeds me, and I take my spoon and feed him. I can get hepatitis from something like that.
Well, I think from the onset, just like Dr. Valerie said, the whole thing is that if somebody would get the infection, there should be transmission from an infected body fluid. But look at sharing a toilet with somebody. The probability that you are going to even come into contact with any fluid from the person is very, 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 very unlikely. Talk less of transmission of a virus. So there are all things that people just speculate because of information that they don't have, or let me just say accurate information that people don't have. So unless there is that transmission of the virus through like the means that she has highlighted, all the other things are just myths.
Awesome. Awesome. So that means that there's no way that the hepatitis is inside the toilet bowl and it will jump up against us anytime soon. So it's good for those of us who are tenants in compound houses. So thank you so much, Amy, for sharing that. But with your expertise as a medical laboratory scientist, can you really tell us what are we testing for? When the Dr. Valerie writes that okay, go do hepatitis B test, what are we testing for? What are we checking out for in hepatitis B test or virus?
Okay, so there are different markers, so to say, or there are different things that could be found from your bloodstream to a layman that can give information as to whether someone has an infection in general. And to narrow it down to hepatitis B, for instance. So usually people will do the Hep B surface antigen screening test, which is in simple terms something that we are expecting that if you have been exposed to the virus would be present in your blood. That's like to a layman. Okay, so
Okay.
basically when they ask you to go and do a Hep B test, usually it's the Hep B surface antigen test where you're trying to detect whether the virus is present or not. But there are of course advanced tests or other investigations that would be done based on what is being investigated. So, for instance, if a patient has done a screening test and a person is testing positive for hepatitis B, maybe the doctor would want to move on to see how, in quote, severe the condition is with probably a B profile test where they are looking at the antigens and antibodies to give an idea of what exactly is going on in the person's body. And then there could be another stage where, okay, now we want to quantify the virus to see if the loads are really, really alarming. How severe is the viral load? So the next test probably could be a viral load test to ascertain the load of virus that we are talking about. So when they tell you to go and do a hepatitis B test, these are some of the things that um, is in mind, and based on the specific request, a specific test would be.
Awesome. Thank you so much, Emil. So we've learned that when your doctor tells you to do hepatitis B test, majorly the very first line is the surface antigen. And then we can move on further to either a viral load test or a profile and whatnot. So you keep the questions coming. I see some questions in the comment section. We'll be tackling them soon, but do keep them coming in. Now that we've narrowed in on the test itself, Dr. Valerie, can you help us with what if my test comes in positive? Like you mentioned, the pregnant woman who did the the hepatitis B surface antigen came in positive. What does it mean for me? Are there any treatments available for me? What next? That's the thing. After being positive, what next?
Okay, so I always like to encourage that a positive hepatitis B virus test is not the end of the world. Basically, it cannot be cured per se, but it can be well managed, right? So some people are carriers, right? So they might have a positive hepatitis B test, but they do not exactly have a, will I say, an existing infection, an occurring infection. So we have infection and we have infestation. So when someone is infected, they might not be infested. That means you might a person might test positive for the virus but will not have symptoms, may never have symptoms. So these people are carriers of the virus. So they test positive. So what we do for them is we would do a follow-up. We would examine them. We would do regular, maybe monthly or 6 weekly tests and examination. We want to check their liver enzymes, whether they are elevated, to know if there's any damage, and to keep following them up in case there's future liver cirrhosis or liver cancer. Now that's for people that are just carriers. So if we find other patients that already start showing symptoms, we will start them on antiretroviral medication. So these antiviral drugs will help reduce the viral load of the hepatitis B virus in them, and they can be able to live a healthier life, right? So this is what we do for them. So it's either they are carriers and we only monitor and follow them up for months and years to, or we will start them on antiviral medications immediately, depending on the level of viral load that they have.
Well, is it possible that I am positive? Sorry, I'm negative, and later I can get to become positive. Or being negative means that's it. I'm covered for life. Like no way ever I'm gonna get hepatitis B. Hooray!
No, covered for life. The only thing that guarantees you cover for life is vaccination, which is absolutely very, very possible. So, and it doesn't mean that because you are vaccinated means that, oh, okay, everyone come to me, if you have hepatitis, I'm good, let's go. No, it doesn't. But but actually, if you're vaccinated, you are covered for life. And it's advisable that every single person, especially health practitioners, get vaccinated against hepatitis B virus. I got vaccinated while in medical school, and I do encourage anybody I see who is, because it's very common for people that live in crowded places to get infected. You talked about the whole toilet thing. You cannot
Yeah.
get it through a toilet, but if you live in a crowded environment, this is because it's easy for you to come in contact with them. It's easy for you to exchange product that they use. Even the salons, right? People like cutting, when they use some of those our instruments, some of them are sharp. right? Like the cutting comb, right? They could use it to cut someone's hair, and they do not sterilize them, and they use it on you. Even for the guys, where they go to the salon, that it's literally a blade they use on their hair, and they do not sterilize it properly, and they use it on you. So it's always encouraged that if you have things that you use like sharps, you should be able to get your own, especially if you go to public places. So I would say that it cannot be cured. It absolutely cannot be cured, but it can be managed. But the most important thing is prevention is better than cure. So the best way to prevent hepatitis is to get vaccinated.
Awesome. Prevention is definitely better than cure. Thank you so much, Dr. Valerie, for really highlighting that and really talking about the vaccines. Talking about the vaccines. Emil, can you help us? I know that when you were a child, you are vaccinated, you get some form of Hep B vaccine. And I know adults also get some of those vaccines. Is it the same? And can I say that because I got vaccinated as a child, I don't need the vaccine as an adult?
Sorry, can you hear me?
Yes, please.
Hello, can you hear me?
Hello, Emil, I can hear you.
Right. So I have had this question quite a number of times when I get to speak about hepatitis B. One time, one gentleman walked, but didn't he raised his hands in the middle of a presentation I was making about hepatitis B vaccine, and the person goes like, "Hello, Emil. So I remember that we are told that when we are children, we are given some vaccines against some diseases, and according to him, he's even been told that he had a fever given to him when he was born. So he doesn't think there is a need to take the vaccine again. And I know most people actually have that in mind. Yes, in majority of the settings now, people are adding hepatitis B vaccine to the vaccines given to children. But even before we come to the science of it, the first question I ask everyone is that what is the assurance that you were given a vaccine against hepatitis B when you were a child? And so long as you don't have any, so let's not even come to science. This is just like mere logic. Me, for one, if you tell me to prove that I was given Hep B vaccine when I was a child, I can't prove that to you.
I
So
can't. I can't. Like, hard. We do.
interesting.
Except yours wasn't.
Ooh, that's nice. Kudos to
Exactly.
your
So
mom.
so I that's why I used myself specifically. Emil cannot prove to you that he was vaccinated when he was a child, and I cannot. Not that I don't trust my parents, but I cannot solely rely on what they tell me that. Oh, when you were a child, we gave you hepatitis B vaccine. So I always tell people that the first thing you should do is, I don't think anyone has taken a vaccine twice and died. And this is a hepatitis B vaccine we are talking about. If you are in doubt and you have no way to prove, like myself, go and get a hepatitis B vaccine. In fact, even when you get the vaccine, we are advocating or advising that you even go for a booster. So in your mind, if you think you can still rely on a vaccine that was given some time ago, see what you are going for as a booster, and then you are okay. Let's not have the notion that we're given vaccines when we were children. So you know what, are protected for life, like Dr. Vanessa says. Be intentional about it and see it as extra protection if you think that that protection is already still there. Yeah. So that's my opinion about it.
Awesome.
Then
Thank you.
another thing I just wanted to quickly add is um the fear people have about, personally, I love the concept of vaccinology. Um the way we approach vaccines. So somebody, let me share another example. Recently, I was invited somewhere again to speak about hepatitis B, and it was a little after the COVID. So, after COVID, when you mention vaccine, everybody looks at you with a different eye.
Yeah. Yeah.
So I did the presentation, and I'm like, the best way to stay safe now is to get vaccine. And there's always like, vaccine again. Me, when I went to for COVID vaccine, my hands got swollen, and people got vaccines and they could stick a phone to their hands. I'm like, wow, show me that person so that we would probably bring the person on TV to prove sticking phone on their hand because of a vaccine. But I just want to use this opportunity to encourage anyone, like Dr. Valerie rightly said, if you are not vaccinated, get it done now. Don't procrastinate because you don't know when next you are coming into contact or you are going to be exposed to the virus. Thank you.
That was actually my second question, that we keep mentioning vaccines. So we are health professionals. We are always with needles and syringes. So it seems like it's not anything huge to us. But to the average African, white, Asian, it's a big deal. Like getting a vaccine is a big deal. And there's this notion that they are now introducing the condition to you. If you go and get the vaccine, you're going to get the condition. They are lying to you. They just want your money and they don't know what they're doing. So imagine speaking to somebody like that. How would you help the person come to terms with the fact that whatever they are saying is maybe a conspiracy theory and what they need is the vaccine? Dr. Valerie,
Right.
can you help? Imagine there's someone here. Oh, I think Emil is both of you. So any of you can come first.
Okay, so basically, vaccines they're different types. So we have the live attenuated vaccine, and I think people have to understand the mechanism of action of vaccines. So we usually take a strain of that virus and we put it like a weaker strain. So when we get the virus, we weaken it and we put it into the individual system. The idea is that our body will create antibodies against that virus. So if at any point in time we come in contact with that virus, our body is prepared to fight it with all we have. But in the absence of a vaccine, what happens is that when someone gets infected with the virus, the body is like, oh, who is this? Hi, 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 hi. I'm John. What's your name? And I just bite everybody, and everybody's like, no, no, Trojan horse and all, right? So that's basically, in simple terms, what happens. So a vaccine is not trying to take over you. It's not some sort of, will I say, conspiracy by the government to take over your mind. It is something to save our lives. And I know a lot of doctors that do not take vaccines, especially during the COVID period, that were like, doctors themselves were afraid of taking vaccines. And I was like, wow, really? Because I took the COVID vaccine personally. I did, and I was perfectly fine. I think at some point I did have COVID, but it wasn't as severe as I would have expected. Now, having a vaccine doesn't say you will not get the infection. It says that if at any point in time that virus strain gets into your system, your body is willing and capable enough to fight against it. But in the absence of any vaccine, your body coming in contact with any virus that you are not vaccinated against, your body will succumb, right? Our body is very amazing. Like in Africa, actually here in Nigeria, we are prone to malaria, right?
Yeah.
Very, very prone to malaria. So now currently we have the malaria vaccine, which I thank God finally is available, right? But imagine, it doesn't mean that you're not going to get malaria anymore. It just means that you are now protected. You have a certain level of protection. So we try to encourage people that vaccine is not a bad thing. It's basically a weaker strain. Now, currently, we are also making some types of vaccines whereby it's not even it's not even gotten from the virus at all, right? Basically, it's a protein that was made in the lab that is similar, like very, very similar to the virus. Because people are afraid that, let's say someone is immunodeficient, right? And he takes that vaccine, what's going to happen is that that weaker strain, which on a normal would not cause any infection in a normal human being, will cause an infection in an immunocompromised person. So now we try to make proteins that have the same structure as the virus, right? And put it into an individual. So the body is a very amazing thing because the body will see that same strain just like it will see the virus itself. So if at any point in time you come in contact with the virus, you are still protected. So as I said, that is basically it. It's just a strain of the virus being injected into your own system that will help you fight future infections to come.
Wow, I feel like I've been in an immunology class. Like that's just like vaccine made easy, vaccine for dummies, vaccine for the audience. Like shout outs to Dr. Valerie. Like I'm really feeling the session right now. Thank you so much for that. I'm sure Emil will agree with because Emil is like pro vaccinology. He's like in charge of vaccinology in his
Wow.
life. So he's like expect boss. So I can imagine how he feels. Emil, do you want to add something to it in terms of vaccine?
Please,
People who agree with
I am only the head of immunology department. Well, yeah. So I think virtually Dr. Valerie has shared extensively what I was going to add. The simplest way I tell people about vaccines too is that when you are taking a vaccine, you are literally just training your body to be able to identify criminals. That is all. So the only way your body is able to fight you is for your body to know what must be fought. That is the basis of it. So the body is being trained so that the body prepares itself, like Dr. Valerie rightly said, ahead of time. It doesn't mean the thief would never come in, but when the thief comes in, you would have probably had quite a good number of soldiers to defeat whoever comes in. So basically, that's how I discuss it or go about it when I'm telling somebody, vaccine hesitancy has become a thing,
yeah.
especially because of misconceptions and how certain theories that you cannot even prove have entered things when it comes to like healthcare delivery, so long as taking up some of these medications are consent. So yeah, I think the best way to put it, like Dr. Valerie said, this one is very, very technical. I mean, immunocompromised individuals and all of this. I was just saying, go there. That's like so immunology classes ongoing, but
I know.
but yeah, that's pretty much it. I'm just adding that if you are not, if you, at least if you had nothing, see it as your body is being trained to identify a criminal so that when the criminal comes in, the body knows who to attack and when to attack. Thank you.
Awesome. Who to attack and when to attack. Thank you so much. If you're now joining us, this is the Health Plot Conversation. I'm your host, Dr. Vanessa, and we've had quite a thrill time laughing, enjoying, learning. And we've learned so much about hepatitis B. But it's time to hear from you, our audience, what your questions are, and that able bodied experts will help us answer before moving on to the other session. So I see a lot of comments. I see that Methodist hymns. Oh, thank you so much. I also see Dr. Finney has given us a bit of tidbits on what we are sharing. Thank you. Sharing on jaundice. All right. Okay, I'm sure Samuela was laughing when Dr. Valerie was sharing her story for hepatitis and HIV. So we are there with you. We are there with you. And yes, early testing is definitely the way to go. Thank you so much, Bruce. We are loving the session ourselves. Awesome. So we have a very first question that says that I was late. I don't know if it's been discussed already, but the question is, can hepatitis B be transferred through sweat? Can hepatitis B be transferred through sweat? Anyone to help us with that? Oh, I see Anna is on stage. Anna, welcome. Finally, we get to see you.
I
How are
know,
you?
right? I'm
You're
fine,
welcome.
thank you.
Would you help us with this question? Can hepatitis B be transferred through sweat? I'm sure sweat is a body fluid, so let's hear from you.
Okay, so hepatitis B is usually transferred through blood and blood products and also body fluids. Um, but I know not necessarily sweat, but let's say you had sexual intercourse with someone who is infected with the virus or through mother to child transmission. I mean, there's exchange of blood during childbirth and all that. So, particularly, and sometimes to blood transfusion, but usually these things, blood are screened before they are given to patients for transfusion. So, yeah, if
Okay,
someone
thank you
can
so
add.
much. Anyone to add anything to it, to what Anna has also shared. Can we get hepatitis B through sweat?
Oh, as I said, I think I said it earlier in the bus that it told me you could, but the best way, it's not exactly just sweat. So someone who is infected, his body fluid, his blood is already with the virus, but the other person who is going to get it through sweat has to have some form of open injury on their own. So let's say you had an open wound, and I don't mean like a scab wound that is already healed. I mean literal open wound that you didn't clean. You're not would like say what's the word?
Dress.
You're not, it's not dressed, right? So a someone infected with the sweat can actually cause it. But what are the odds that you have an open wound and you're rubbing it on someone's body that is sweating, you know? And and that problem is the hepatitis B virus can stay on a surface for hours, right? It can stay on a surface for hours. So this enforce us to wear our scrubs, close scrubs. Scrubs usually have these holes in them, and
Yeah.
they always discourage us to wear open scrubs into the theater, that we should wear closed scrubs, because the hepatitis B virus can stay on your toenails for hours. Right now, it's not going to infect you, it will just be on the skin surface. So but let's say toe, or you are doing a pedicure and you literally just cut yourself. Now that virus that has been on your skin has a propensity of entering into your body system. So it's very crazy, but yes, it can transfer to sweat, but the probability is very low. So what do you do to prevent things like this? Once you go in a public place where you have a lot of contact with people, when you get home, try to shower, right? Because the virus outside the body can literally not do anything. So when you shower early, make sure you have good hygiene. You have a higher chance of getting rid of it before it even enters into your system. Yeah.
Awesome. Thank you so much for adding on to that. Remember, when you come out shower, I think you gave a scare to those of us who like pedicures. Like, oh my god, I'm looking at my feet and I'm like, do I have hepatitis B? Like, can I really go and get my pedicure done? But hey, we
No,
go regardless.
yes,
All right, that's another question.
and stuff. Yeah.
Okay. Okay. There's another question from Emmanuel Asari. He's asking, can hepatitis B patients use herbal drugs to reduce viral loads? Okay, man of the moment, man to man. Emil, can you help us with this before any of our other speakers add
You,
in?
you know why I started smiling, right? After you read out the question, because these are like, um, let me say, frequently asked
Yeah.
questions, right? They are the questions you get anytime you're having some of these presentations. And um, let me give you a scenario or a case study. So I was having a discussion with this gentleman that says that he had hepatitis B, and we've lied to them for long because he went to herbal, do some herbal stuff, and he's back. And then he showed me his results and hepatitis B results. I don't know where he had it from, but well, his result is negative hepatitis B. And you look at his liver and his ALs, his liver enzymes are skyrocketing like they are
Oh
going to
my
heaven.
god.
And I'm like, what will kill you if you believe hepatitis B is God? What will kill you is your liver that is damaged, and not the hepatitis B that you are scared of. That's just like a joke. But so this is the thing. I believe that alternative medicine isn't bad. That's just to say that herbal medicine isn't bad. But how many of us have seen any drug that is herbal, that is labeled and well recognized or approved that it is used to cure hepatitis B, or it is used to, like you would say, prevent the virus from growing? Now, the challenge is that we need to understand that these herbal stuff, if care is not taken, may now be damaging the same liver that they are trying to save, because toxins now becomes more, and the body has to deal with some of these things. And in attempt of clearing your hepatitis B through a means that probably have not yet been approved or something, you end up worsening the liver's situation and getting it to now get into a condition where maybe because we could have saved you earlier, you are coming in at a point where nothing could be done, or you've advanced past acute, in fact, liver cirrhosis or something is setting in and nothing can be done about it. So the first question, you see, I help you to make this decision yourself so that you don't say that ML says that. The question I would ask you is that herbal thing you are taking, show me an approval that says that this, because even orthodox medicine, you're supposed to have a license, an approval that shows that research has been conducted and this provides this particular treatment. So if you are able to prove that research is being done on this, then probably you have a product that we should all be looking into too. Because of course, it's not like we fancy putting aside herbal drugs, but come out with certain researches. Let's see, let's test it, let's conduct a test. Let's see if actually this thing is going to get rid of the hepatitis B you are talking about and still not cause harm to the 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 human liver. Then we can trust you. So unless you have that proof, please go according to the treatment that has been tested and that works. Thank you.
Thank you too. Thank you too for sharing on that. I think the point is loud and clear. Very, very loud and clear. You know, the last time I was having a conversation with a taxi driver who was pro herbal medication. You know, was telling me when I was mentioning some of these points that do I know that contumely is a herb? It's medicinal. When I'm preparing contumely stew, do I calculate the number of contumely leaves I put in my stew? And when I'm eating it, can I tell myself that this is 2 contumely leaf stew that I've eaten, and this is 3 contumely leaves that I've eaten to really tell that it is working? And I'm just deceiving him. So these things are real. People really have these kinds of mindsets, and I'm so glad that we are addressing them now. Okay, our next question is this. Concerning what I know, hepatitis B test, hepatitis B profile test, sorry, can tell if one is vaccinated successfully or not. So if one is not 100% sure, can he or she go for the hepatitis B profile test to check if that have been vaccinated already? If they have been vaccinated already. Anyone to help us with this question?
Okay.
Okay.
I think
Sorry.
I think immunology chief to answer this question.
Please do. Which one is immunology chief right now?
Immunology chief Igwe, over to you.
All right. So I was just going to put out a simple concept that I usually tell people when it comes to vaccination. The truth of the matter is that vaccination doesn't guarantee immunization. And when I say that, what I mean by that is that the fact that you have taken a vaccine doesn't mean 100% that you are immunized, unless, of course, there is a proof of immunization. That's probably there is antibodies that shows that you are vaccinated. So yes, when you take the vaccine, this is one part of the advocacy that I think we should also be looking at, because
Okay.
majority of us preach people getting vaccinated, but we never actually make it clear that once you are vaccinated, because somebody would take one and then never return to take the vaccine, and they say that they say we should take vaccine. Me, I've taken one, at least I'm okay. But we need to know that vaccination doesn't guarantee immunization. You need to be immunized. When I say immunization, it simply means that now you have built certain antibodies to protect you should you be exposed to whatever you were vaccinated against again. So yes, you can do a Hep B profile test and get the idea from the Hep B surface antibody now, because then you know that the body has produced antibodies against the virus we are talking about. And if you want to quantify it, you know, the profile test doesn't really quantify, although they have minimum ranges they can measure. You can go ahead and actually even do a quantitative measure of antibodies you have against the Hep B surface antigen as a way of determining if you are actually immunized. I hope I
Okay.
answered Ubert's question.
There you have it, Obert, from the chief immunologist himself, aka Health Commander, aka Igwe of today. you can get a hepatitis B profile test, check for the antibody, surface antibody, and you'll be able to tell whether you've been immunized and not just vaccinated. Awesome. And we have our next question from Mr. Sami Kwame, and he's asking that does the hepatitis B vaccine have any side effect? Does it have any side effect? Anna, do you want to help us with this? We've not heard your voice for quite a while. We want to see if you can sing us with your voice.
Okay, so like any other medication, um, there are potential side effects to getting taking in a medication or taking in a vaccine. Yeah, so I believe there are side effects to being vaccinated with the hepatitis B virus. And usually with vaccines, one major side effect is having running temperature, high body temperature, because I mean your immune system is trying to fight against the vaccine that was inserted into your bloodstream. Yes, you can have headaches, and all that. So just like any other vaccines or medications, there are potential side effects. Yeah, but I don't think they are really adverse side effects. Maybe the doctors can help us with that. Yeah.
So Anna has mentioned that yeah, there are side effects, but it comes with the fact that it's a vaccine. Okay, the headaches, the fever, kind of like what people had during COVID. So you would have the side effects, may not be as adverse as you think, still dependent on the person, anyways. Does anybody want to add anything to it? Because Anna has requested for other people to add anything to it. I'm wondering why, but all right.
I have nothing to say except, Anna, have you been vaccinated? I think all of us should first of all be here. We should all be like, if you have been vaccinated, raise your hands so that we can all because if we all have been vaccinated, we have what they call, like, they say taste and see that the Lord is good. Sorry, I'm using something like that. But if you've
Oh,
been
glory,
vaccinated,
hallelujah.
you would know what you went through, right? Personally, when I got vaccinated, I was fine, right? But I think it's person driven, because my other friend, she was also vaccinated, because we were all pushed in school to go get vaccinated. And she was like, she felt pain in that arm for a while, right? For like a day, 2 days, she felt pain in that particular arm. So I think that is one of the complications. Fever is also a very common complication. Another complication is, you might feel like some people might vomit, because vomiting is basically, when they say vomiting and diarrhea is any drug that you take, like, it's like a very, very common complication. If you have
Common
nothing
side
to say,
effect. Yeah.
just say vomiting and diarrhea, right? So, but aside that, it is very good. And I love what Emil said. Emil said, when we talk about the vaccines, if I can remember correctly, that oh God, I forgot. I've lost my train of thought there. But what I'm trying to say is that it's actually very safe. Yes, when you take one dose, right? When you take one dose, please do ensure to take the other two doses. So there are three doses that you're supposed to take for the vaccines. Most people take one dose and they just like, oh, I've taken one and I'm fine. Please, you are not fine. What you are doing to yourself is you are just infecting yourself with the hepatitis B virus. It's very funny because when we were doing medicals, one of my colleagues took only one dose, and when they did the test, they were like, you have hepatitis B, you're positive. And she was like, God forbid that she's not. But it was basically just the profile showing that she had the anti will I say the antibody, right? Not the antigen per se, because of she took the vaccine. So do ensure to take three doses and not just one dose, just because you feel that, oh, okay, I've been vaccinated, because as vaccination is not immunization. Yeah.
Awesome. Thank you so much. Just a follow up on that. So just imagine that I'm listening to this conversation and unfortunately I was ignorant. I didn't know. I just took one vaccine. What happens for me when I'm going to take another one? Am I starting afresh or I'm going to continue like from where I started from? I don't know if I my question is clear. Imagine I want to continue or I just go and take a booster and then I'm fine. Can anyone help me with that?
So I know it's advisable to, well, it depends on when we are going to take the next dose. I can be corrected. Usually after the first dose, a month after, you take the second shot. So if you delay, let's say 3 months, 6 months, it's advisable to start the entire process again. Yeah.
Okay. Okay. So, irrespective of where you are, once you realize that it's taking quite a while, maybe 10 years, 5 years, you've been guilty for so long, and now we've preached the gospel of hepatitis B to you, receive salvation, receive vaccination. This is your time to receive the vaccination for hepatitis B. Please do go get it and make us all proud. Awesome, awesome, awesome. We'll be wrapping up very, very soon, but we'll be talking about a very important aspect of this hepatitis B. Then we'll come back to the audience. The question is on family, marriage, and then stigma. Someone asked me in this health talk one time when I was talking about hepatitis B that she went for a premarital counseling, and as part of the routine checkup, they check for various tests, including hepatitis B. And she came out positive. Her partner then saw it and said that it's over between them. He cannot marry someone with hepatitis. She was crying and asking me that, can someone with hepatitis get married? Can she have children? Is this the end of the road for her? Should she be celibate? Should she start being a nun? What really is the journey for her actually as someone who has hepatitis B?
Okay,
Chief,
so
Anna. Anna, you can, let's hear from you.
I mean, I'll use a practical example, a friend of mine. So in her situation, the partner has left her. That is not the end of her life. I mean, if thankfully if she gets someone else, I think the best thing is to be open about your status and let the person know what he is getting into. And for the friend I know like this, she openly told the person, and the guy was willing to go ahead with her in terms of marriage and all. So if you let the person understand that, I mean, when you take the vaccine, and you gain immunity, it doesn't mean that you'll be infected by me. And also in terms of like, will your children get it and everything, there's like a protocol for that too, to protect the child from getting infected by the virus. So sometimes this conversation, you just have to reassure the person that that is not the end of their life. You can actually manage and even grow out of it. Some get just become carriers and not infecting others. So just reassuring the person and knowing that there is a standard treatment and management for it to prevent reinfecting your partner or your children. So yeah, they can get married. They can manage their family.
Thank you so much. And I think that's very reassuring, especially for people who are younger and are yet to marry and they found this out. So thank you so much for sharing on that. The next question really is, aside marriage and children, some people would say that I feel fine. You keep saying it's a silent treatment. I feel fine. I'm too afraid to voice out that I have hepatitis B because of the fear of the stigma that is surrounding it. Everybody will know that, oh, this guy, he's nice, but he has hepatitis B, like the tag related to it. How would you speak to someone who wants to hide their diagnosis out of fear? What do we want to tell them? Emil, can you help us with that?
Well, so this is the thing. It's very, very natural and very human to want to hide what society doesn't really accept. But this is the thing. I think that the issue of declaring your status when it comes to hepatitis B and HIV is because of the way community accepts some of these things. If you know your status, declaring it is a way of showing love. Now you see, I another part of advocacy that I think that we should also be looking at is advocating for people with hepatitis B, because majority of work is being done on prevention, which is the ultimate, which we all love to do. But when somebody has the infection, we need to intentionally encourage them to know that, like we rightly said, that isn't the end of life. There are people with hepatitis B that are living very, very, very normal lives. In fact, some of them are even healthier than those that do not have the condition. So be open about it, be confident about it. The only thing that will make you confident about it is if you are taking very good care of yourself, because that's when you can prove to people or whoever has their own doubt about your abilities. There are some people that will not even want to work with you because they think you have hepatitis B. And it's only because those people are not really educated. They don't know about it. You should be the point. I know someone who is hepatitis B positive and is an advocate for hepatitis B patients.
Oh.
And this person is strong. Giddy giddy. I'm sure if you see both of us standing there and you're supposed to choose a husband, you choose him over me. And that is normal. Yeah. So I'm just trying to say that don't let the fact that you are positive. Look at all these things we are talking about. Some of them are things that, my dear, you might not have even known. You probably picked up the infection sometime back when you were trying to cut your nails with the sharp thing that a friend just gave to you, and you didn't know even that hepatitis B could have been transmitted through some of these means. But it doesn't end your life there. Get to know what treatment is available. Be conscious. If I use yourself as a scapegoat, tell yourself that I'll be an example to everybody that has hepatitis B, that we are also very normal. We can live our lives like every other person. We would show love by telling those who are not our status in order to protect them and protect those around us. See the confidence and vim I'm talking with. Get that
Yeah.
same vim. Uh,
Wow. Awesome. Lovely. Lovely. Do any of our speakers want to speak on the matter of stigma? On the matter of stigma? I love how Emil said it. Be an example. Show love to those who do not know they have hepatitis B by owning your hepatitis B. It's a way of love. It's a way of love. Any of the speakers want to add something to stigma before we wrap up our session today?
I think from the other end of the spectrum, so those that we are not positive, we shouldn't be in the habit of stigmatizing people. Thankfully, this is trying to give us knowledge about how the virus is transmitted and all that. As I said, this person I'm talking about is a very close friend of mine, and she had it at work. She didn't even know about it. So we're students, we were asked to go and vaccinate. You do the test before and everything. That doesn't mean that I have to stop being her friend. You get it? So from the other parts, those who don't have it, we should be in a position to welcome these people and even allow them to be open to talk about their status. Yeah.
Thank you so much, Anna. We should be their friends and be open to allow them talk about their status. Dr. Valerie, do you have anything to add?
I think we all should hold ourselves. I think what Emil said is perfect, right? Love is the principal thing. We can't do this on our own. We may not. Some people may have hepatitis B, others may not. But I think everyone has something that they are suffering from, right? Because yours may not involve a stigma, doesn't mean that you should stigmatize others. There's this thing, I hope, sorry, I always use scripture, said, he that hasn't seen, let him throw the first stone. So why stigmatize others just because we can't see the sickness that's on you? So that's fine.
Thank you so much. That's so profound. Wow. What a session. My God. I have really enjoyed myself. I don't know about the other speakers, but it's been very insightful. It's been very interesting. We've got an Igwe here. We've got Dr. Valerie with all the bars. We've got
Where is
Dr.
he
Anna with
from?
all the
Where is Emmy, where are
oh,
you from? I'm Nigerian.
interesting.
Who gave you that title?
What
it's
a
Dr. Vanessa making me an Igwe by force.
Igwe of immunology, oh guys.
Please,
It's
so
brand new here. Everybody will hear. I've had
It's
fun. I've had a wonderful session. I believe my audience to have. I think Esther is saying so. This really has been a wonderful session. I totally agree with you, Esther. I'm so glad that we had this. Sammy also says that he's glad that he joined. Louis mentions that it's been a wonderful session and he loved the session. Thank you so much to a lovely speakers for coming on board and making sure that we have the right knowledge about hepatitis B. This has been fun. This has been educative. We'll be leaving very soon, but before we do, I just want to give you just 10 seconds. Firstly, I want you to tell me one key message you have out there for anyone listening to us. It can be about hepatitis B, it can be about life, it can be anything at all. Before we leave this session, one thing you want to leave with every single listener or viewer for today's session. And I think I would like to start with Dr. Valerie. Dr. Valerie, if you are still there, we want to hear from you for the last. What is your final takeaway, your final message to us all?
Okay, finally, I'd like to say that if you're living with hepatitis B, um, I don't want you to be afraid. There is love, there is care, and there is support for you. And if you've never tested for hepatitis B, I do encourage you to please get tested. And remember, no matter the outcome of the results, we have love, we have care, and we have support.
Oh, awesome. Thank you. You have love, we have care, and we have support. That's so lovely. Anna, can we hear from you? What is your final key takeaway for today's listener or viewer?
Okay, so what I have to say is that when you are tested positive, it doesn't mean that that's the end of your dreams or your life. I mean, there is, as Valerie said, there is love out there. Just be an advocate as well. You can be an advocate for other people, be the voice that others don't have, and advocate for people. And just know that there's good management out there, proper follow up, checkups. You can live a normal life like any of us. Yeah.
Thank you so much. There's love out there for you, everybody. I like how we are all preaching love because there's really love out there. And the greatest of all the loves, I can't leave here without saying it, is the love of God. Don't feel like you are forsaken. Don't feel like you are alone. God loves you. God is there for you all the while. And we'll take our last session from our Igwe of today's session. Your final takeaway for us, Emil.
All right, so to everyone on the call, I mean, you definitely would be on one side of the coin. Is either you have hepatitis B infection or do not have the infection. If you do not have the infection, I mean, we've overemphasized the fact that you need to get vaccinated. And if you have been vaccinated, please do well to check if you are immunized by having a profile test or going to check the antibodies to see if you've already produced them. Then, for those of you that probably have tested positive for the infection, know that this is not the end of life. In fact, I don't even like using the statement this is not the end of life because it shouldn't be a thing in your mind, especially given that there are effective management procedures. So, every other person on this call, I just need one thing from you after our session today. Just type onto your status wherever possible. Just tell them, please get the hepatitis B vaccine now. Just type that. When they ask you how or where, then you can direct them to any public health facility to do that. Thank you very much.
Thank you to Emil. And with that, we come to the end of our session today. I believe it's been wonderful. It's been insightful. My name is Dr. Vanessa Abokoma, and I have been your host for today's session. If you want to join us, you want to collaborate, you want to be a speaker, you want to partner with us, I would like that you can reach out to me on LinkedIn or on the contact number that is below the screen. You can also join the Health Plug conversation and the Health Plug network, where we talk more about health and staying on top of our health game. Till next time, see you. Bye bye. Bye, everybody.
Bye.
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 Bye.